Let me ask you something uncomfortable. If your doctor looked at you today and said, based on your biology, there is one specific way your body is statistically more likely to break down after 60, would you want to know? Most people say yes, they definitely want to know. And then they spend the next 10 years ignoring the exact warning signs their body has been sending them. Here's what surprises me after decades studying aging, cardiovascular health, and preventive medicine. There is one piece of information almost every person already has, yet almost nobody uses correctly. It's not your cholesterol level. It's not your current weight or body mass. Not even your blood pressure. The answer is your blood type. And no, I'm not talking about trendy blood type diets or internet myths. I'm talking about real epidemiological research involving hundreds of thousands of people over decades. Research showing that your blood type may influence how your arteries age, how your immune system reacts under stress, how inflammation spreads through your body, and even which diseases become more dangerous after 60. Today, I'm going to walk you through every blood type, O, A, B, and AB. And for each one, I'll explain the hidden health risk most doctors never have time to discuss during a routine appointment. Not because they're hiding something, but because modern medicine is rushed, and these deeper biological patterns are rarely explained in detail. But before we continue, I want you to do something simple. Write your blood type in the comments below, O, A, B, or AB. Because once you understand how your own biology behaves after 60, this video becomes personal. Now let's begin with type O. Type O is the most common blood type in the world. Nearly half the population carries it. And historically, this blood type was associated with survival, endurance, and physical resilience. Early human populations with type O blood adapted to physically demanding environments, high stress conditions, and protein-heavy diets. And even today, many type O adults over 60 still carry some of those advantages. Research consistently shows that type O individuals tend to have lower levels of certain clotting proteins in the blood. That means blood often flows more smoothly, platelets are less sticky, and the risk of dangerous arterial blockages may be lower compared to other blood types. In simple terms, many type O adults have a naturally lower risk of certain heart attacks and ischemic strokes. That's the good news and something to celebrate. But here's the dangerous part nobody talks about. That advantage often creates a false sense of security. I've seen this many times. A type O patient walks into my office at 62 years old. Blood pressure looks acceptable. Cholesterol is not too bad. No major cardiac history. So they assume everything is fine. Meanwhile, another system in the body is slowly deteriorating for years without symptoms. And for many type O adults, that system is the stomach. Studies have shown that people with type O blood may be more vulnerable to Helicobacter pylori infection, a bacteria that damages the stomach lining over time. The problem is that H. pylori rarely announces itself dramatically in the beginning. It works silently, slow inflammation, gradual irritation, subtle digestive discomfort, occasional bloating, burning sensations people ignore, and after years of chronic damage, this process may increase the risk of ulcers, bleeding, and in some cases, stomach cancer. Because prevention becomes much harder once years of damage have already accumulated. And there's another important detail. Many type O adults regularly use anti-inflammatory medications like ibuprofen or aspirin for joint pain, back pain, or arthritis. But long-term use of these medications can slowly erode the stomach lining even more. So when you combine type O vulnerability, chronic inflammation, and years of NSAID use, the stomach becomes extremely vulnerable after 60. Now here's the good news. This is one of the few risks you can actively reduce with daily habits. Fermented foods like kefir, yogurt, kimchi, miso, and naturally fermented vegetables may help support a healthier gut environment. Regular walking also matters more than most people realize. Type O adults often respond extremely well to movement because their nervous systems tend to run at a higher stress response baseline. And when that stress energy has no outlet, it becomes poor sleep, high cortisol, fatigue, irritability, and chronic inflammation. 30 minutes of walking daily may do more for your long-term health than expensive supplements most people waste money on. Type O adults often inherit cardiovascular strength, but their digestive system requires protection. And ignoring that vulnerability simply because your heart seems fine is one of the biggest mistakes I see after 60. Before we move to type A, tell me your age and where you're watching from. I read the comments personally, and I truly want to know who's here with me today. Now let's talk about type A. And I want you to pay very close attention here, because this is the blood type where stress becomes far more dangerous than most people realize. Type A individuals evolved during a period when human beings began living in larger agricultural communities. Life became more crowded, more socially complex, more emotionally demanding, and over time, the immune system adapted differently. Type A adults often develop very strong immune responses, especially against certain infections and inflammatory triggers. In younger years, this can actually be an advantage, but after 60, that same biology can quietly begin working against you. Here's why. Research has shown that Type A individuals tend to have more active clotting responses compared to Type O. Their platelets are often stickier, coagulation activity tends to be higher, and blood vessels may become more vulnerable to chronic stress damage over time. Now, by itself, that may not sound alarming. But the real danger appears when you combine that biology with something extremely common after 60, chronic cortisol elevation. Cortisol is your body's primary stress hormone. In small amounts, cortisol is useful. It helps you wake up, focus, react quickly. But when cortisol remains elevated for years, it begins damaging the inside lining of blood vessels, and this is where Type A adults become especially vulnerable. Because inflamed arteries combined with sticky platelets create the perfect environment for vascular damage. That damage often develops slowly and silently, no symptoms, no warning, no dramatic pain, until one day it becomes high blood pressure, reduced circulation, a transient ischemic attack, or even a heart attack. I've had patients tell me, "But doctor, I eat relatively well." And then I ask them another question. How stressed are you every single day? And suddenly everything changes. Because for many Type A adults, stress is not just emotional, it's biological. Their nervous system often stays activated even during rest. And after years of living that way, the cardiovascular system begins paying the price. This is why I tell my Type A patients something that may sound unusual. Stress management is not optional self-care. It is cardiovascular medicine. And if you are over 60 with Type A blood, you should monitor your blood pressure far more carefully than most people do. Not once a year, regularly. Because small elevations repeated over years slowly damage arteries, kidneys, eyes, and the brain itself. There's another marker many people have never heard of, homocysteine. Homocysteine is an amino acid that, when elevated, may contribute to arterial inflammation and vascular damage, and Type A adults tend to be more vulnerable to elevated levels over time. The good news? The solution is often surprisingly simple. Foods rich in folate, vitamin B6, and vitamin B12 may help support healthier homocysteine metabolism. Dark leafy greens, eggs, beans, fish, lean proteins, simple foods. But over decades, small daily decisions create enormous biological differences. Now I want to tell you something I've observed repeatedly in Type A adults over 60. They often ignore exhaustion. They continue carrying emotional pressure quietly. They become caretakers for everyone else while neglecting themselves completely. And their body absorbs that pressure year after year. Then one day they say, "I don't understand why my blood pressure suddenly exploded." But it didn't happen suddenly. The body had been warning them for years. The nervous system had been overloaded for decades. And this is why daily nervous system regulation matters so much for Type A adults. Not once a month. Not only during vacations, daily. Even 10 minutes every morning of slow breathing exercises can significantly lower stress signaling inside the body. One of the techniques I recommend most often is incredibly simple. Breathe in slowly for 4 seconds. Exhale slowly for 6 seconds. Repeat that for 10 minutes. Clinical studies show this kind of breathing may help regulate cortisol, lower sympathetic nervous system activation, and improve vascular relaxation. And consistency matters more than intensity. 5 minutes every day is more powerful than 1 hour once a week. Now here's something very important. Many Type A adults appear calm externally, while internally their nervous system never truly relaxes, and over time, that hidden stress affects sleep quality, inflammation, digestion, circulation, memory, and even immune function. So if you are Type A, I want you to remember this sentence. Your greatest health risk may not be what you eat occasionally, but the stress your body carries continuously. Type A adults often have remarkable resilience, discipline, and mental endurance. But after 60, protecting your cardiovascular system means protecting your nervous system first. And in a moment, I'm going to explain why Type B adults face a completely different problem, one that many doctors still overlook today, especially when inflammation starts showing up in strange and unexplained ways. Now let's talk about Type B, and this is where things become extremely interesting, because Type B adults often appear healthy for years while inflammation quietly builds underneath the surface. Type B blood developed in populations that migrated through harsh climates and constantly changing environments. Because of that, Type B individuals evolved with something remarkable: metabolic flexibility. In simple terms, many Type B adults can tolerate a wider variety of foods and environmental changes better than other blood types. Their bodies often adapt well. Digestive systems can be resilient. Energy levels may stay stable longer. And for many years, that adaptability becomes a major advantage. But after 60, that same immune flexibility may also become a hidden vulnerability. Here's what I mean. Many Type B adults experience symptoms that don't seem connected at first: joint stiffness, unexplained fatigue, brain fog, digestive discomfort, skin irritation, swelling, chronic inflammation, muscle aches, and very often they are told the same thing: you're just getting older. But sometimes, that is not the full story. Research increasingly suggests that Type B individuals may react differently to chronic inflammatory triggers, especially modern ultra-processed foods. And this is critical to understand, because inflammation does not always appear dramatically. Sometimes it develops silently for years. Low-grade immune activation, constant irritation inside blood vessels, persistent stress on joints and tissues, gradual metabolic dysfunction, until eventually the body begins showing symptoms everywhere at once. One of the biggest problems today is that the modern food environment constantly overstimulates the immune system. Refined seed oils, highly processed snacks, artificial additives, excess sugar, high fructose corn syrup. These ingredients may create a much stronger inflammatory response in some Type B adults compared to other blood groups. And many people never realize it. They simply think, my energy disappeared after 60. My body feels older. My joints hurt all the time. Meanwhile, the immune system has been running in a chronically activated state for years. This is why I often recommend that Type B adults ask their doctor about inflammatory markers, like C-reactive protein, also called CRP. CRP is a simple blood marker that may reveal whether inflammation is quietly building inside the body. And if your CRP remains elevated consistently, your body is trying to tell you something. Now let me be very clear about something important. Inflammation itself is not the enemy. Inflammation is part of healing. The real problem is chronic inflammation that never fully turns off. That's the kind of inflammation associated with accelerated aging, cardiovascular problems, autoimmune dysfunction, fatigue, and cognitive decline. And this is where many Type B adults become vulnerable, because they often continue functioning reasonably well even while inflammation is slowly damaging tissues underneath. I've seen patients who ignored symptoms for years because they could still push through, and eventually the body reaches a breaking point. Suddenly, arthritis worsens, blood sugar rises, energy collapses, or autoimmune symptoms become impossible to ignore. Now here's the encouraging part. Type B adults often respond extremely well to lifestyle adjustments once inflammation is reduced. And unlike what many people believe, those changes do not need to be extreme. Simple adjustments repeated consistently create the biggest long-term results. Reducing ultra-processed foods, improving sleep quality, walking daily, maintaining stable blood sugar, eating anti-inflammatory whole foods, managing stress hormones. These small habits gradually calm immune signaling inside the body, and movement matters tremendously for Type B adults. But here's the important detail. High-intensity exercise is not always the best option after 60. Many Type B adults respond better to sustained moderate movement rather than aggressive training that spikes inflammatory stress hormones. walking, cycling, swimming, light resistance training, hiking, activities that improve circulation without overwhelming recovery systems, because after 60, recovery becomes just as important as exercise itself. And there's another detail many people overlook. Poor sleep dramatically worsens inflammatory activity. Even one night of inadequate sleep can increase inflammatory markers inside the body. Now imagine what happens after years of poor sleep. The immune system never fully recalibrates. And slowly, chronic inflammation becomes the body's new normal. This is why type B adults must treat inflammation early, not after disease becomes advanced. And I want to say something directly to anyone watching this who constantly feels dismissed by others. If you feel exhausted all the time, if your joints constantly ache, if your body feels inflamed, if your symptoms keep getting minimized, please do not automatically assume it is just aging. Sometimes the body has been sending warning signals for years before conventional testing finally catches up. Type B adults often have incredible adaptability, but adaptability only works when the immune system stays balanced. Once chronic inflammation takes over, that same powerful immune response can begin damaging the body itself. And now, we arrive at the blood type that researchers have become increasingly interested in over the last decade. Type AB. Because what scientists are discovering about type AB and cognitive decline after 60 is something every older adult should understand. Now let's talk about type AB, and I need you to stay with me carefully here, because this is the blood type that surprises people the most. Type AB is the rarest major blood type in the world, and biologically, it is also the newest. It developed much later in human history, when populations carrying type A and type B blood began mixing more frequently. Because of that, type AB inherited characteristics from both blood groups, and in some ways, that creates advantages. Many type AB adults appear remarkably resilient in certain inflammatory conditions. Some studies suggest they may carry lower risk for specific gastrointestinal complications compared to other blood types. But here is the part that concerns researchers far more after 60. Type AB individuals appear to carry a higher risk of cognitive decline and vascular dementia compared to type O adults. And the reason is deeply connected to circulation. You see, the brain depends on extraordinarily delicate blood flow. Tiny microscopic vessels constantly deliver oxygen and nutrients to regions responsible for memory, processing speed, focus, decision-making, and emotional regulation. The problem is that type AB blood often carries higher clotting activity combined with more complex vascular signaling patterns. And over decades, those tiny blood vessels inside the brain may gradually become less efficient, not through one dramatic blockage, but through slow, microscopic reductions in circulation year after year. Most people never notice it at first. They simply begin saying things like, "I forget words more often. My focus feels slower. I walk into rooms and forget why. My memory isn't what it used to be." Now listen carefully. Some degree of cognitive slowing can happen with aging, but when circulation inside the brain deteriorates chronically, the decline accelerates much faster. This is why I tell my type AB patients something extremely important. Your brain health and your cardiovascular health are the same conversation. They are not separate systems. Every decision that protects blood vessels also protects cognitive function. Blood pressure control matters. Blood sugar stability matters. Triglycerides matter. Sleep matters enormously. And one of the most important nutrients for many type AB adults is omega-3 fatty acids, especially DHA. DHA becomes part of the actual structure of brain cells. It helps maintain membrane flexibility, supports communication between neurons, and may help reduce neuroinflammation associated with aging. Fatty fish like salmon, sardines, mackerel, and trout can become incredibly valuable after 60. And if someone does not consume fish regularly, discussing omega-3 supplementation with their physician may be worthwhile. But there is something even more important than supplements: sleep. And most people severely underestimate how critical sleep becomes after 60. During deep sleep, the brain activates a waste clearance system called the glymphatic system. Think of it as the brain's nighttime cleaning process. During those deeper sleep stages, the brain helps remove accumulated metabolic waste products associated with aging and neurodegeneration. But when someone sleeps only 4 or 5 hours repeatedly, that cleaning process becomes impaired, night after night, year after year. And for type AB adults, this may become especially dangerous, because their brains may already be more vulnerable to small vessel circulation problems. So when poor sleep combines with vascular stress, cognitive decline can accelerate dramatically. This is why I tell my patients, protecting your sleep after 60 is not laziness. It is neurological protection. 7 to 8 hours of quality sleep consistently may be one of the most powerful anti-aging interventions available. Now, before we finish, there's another piece almost nobody talks about, the Rh factor, that positive or negative sign attached to your blood type. Most people know their blood type letter, but they completely ignore the plus or minus. And biologically, that detail matters more than many realize. Around 85% of people are Rh positive. The remaining population is Rh negative. And emerging research suggests Rh negative individuals may react differently to inflammatory triggers and immune stress. The research is still evolving, but evidence increasingly suggests that Rh negative adults may experience heightened inflammatory sensitivity in certain situations, which means if you are Rh negative and already struggling with chronic inflammation, the lifestyle changes we discussed today become even more important. And for women, Rh compatibility during pregnancy is something that absolutely must be monitored medically. Now let me tell you the most important thing in this entire video. Your blood type is not your destiny. It is not a sentence. It is not a guarantee that disease will happen. It is a biological map. And maps are useful because they help you prepare before problems become catastrophic. I've met type AB adults in their 70s with sharper minds than people 20 years younger. Not because they were lucky, because they became proactive early. They protected sleep, controlled blood pressure, walked daily, reduced inflammation, stayed mentally active, protected circulation consistently. The risk profile was still there, but they refused to let it silently accumulate for decades. And that is the difference. The gap between genetic predisposition and real-life outcome is enormous. And that gap is filled by daily habits repeated consistently over years. So now, I want to ask you something. Did the profile I described today sound similar to what you've personally experienced after 60? Tell me your blood type again in the comments. And tell me whether this information surprised you. I read the comments carefully because they help me understand what people are truly struggling with today, and if this video helped you understand your body differently. There's another video waiting for you right now, where I explain the hidden causes of chronic fatigue and high blood pressure after 60 that many older adults completely overlook until serious symptoms appear. Take care of yourself. You have carried this body for a lifetime. It deserves to be understood before problems become irreversible.